And action. Hey everyone, it's Dr. Rick, and Ignacio had a question about DGL. DGL, we'll get to in a second, is one of those herbs that we use to calm down the stomach and help with healing. Now, I think most of us are used to Tums or an antacid swig of Malox or Mylanta, but I have other things that you can take advantage of that will probably help you heal fast. If this is the first time you're finding me though, don't forget to hit the subscribe button down below and the alert button to find out when I do new videos. So DGL, deglycyrrhinated licorice, does help with cooling down the stomach, especially if you have an ulcer. But so does marshmallow root and slippery elm. The standard treatments are Pepcid and Tums and possibly proton pump inhibitors. I'll talk about that in a second. The reason I'm doing this is I'm getting a lot of patients with symptoms of reflux and acid and ulcers, radiating pain to the back, and I'll explain how that happens in a second. But it could be the season, it could be that there's a lot of stress, it could be there's also darkness and everybody's actually having a little bit of seasonal affective disorder, because it can manifest not only as mood but as symptomatic relief, or not relief, but symptomatic problems with the digestive system. So this is how the digestive system works. You start with this is a food particle, this is a mouth, and this is a nose. I'm not sure what kind of nose that is, but the mouth, you start to break down food solids up in the mouth with the tongue, the saliva, the amylase from the saliva, and the teeth. Then you get to swallow it. This is the pharynx, and this is the esophagus. Here's the food pellet as it goes down the esophagus. Esophagus is just essentially one big tube that's all muscle. It takes the food from up here and puts it down here. It also helps so that if you stand on your head, you don't have the food come this way. It's a strong muscle. A lot of that muscle is strengthened in something called the lower esophageal sphincter. Lower esophageal sphincter is the choke point that food has to get down. And then once it gets down past that point, it closes. Usually, the lower esophageal sphincter closes off tight, like a sphincter in your butt. The anal sphincter is also tight, otherwise you'd be leaking poop all the time. Well, esophageal sphincter is supposed to be just as tight. Problem is, we just damage it so much with coffee, acid, high acid foods, tomato, citrus foods, alcohol, spicy foods, eating, and then lying down, so it gets damaged. There's going to be acid in the stomach. That's how solids get converted to liquids. That's what that is. It's the solid being unraveled. And when the acid meets the solid, it starts to digest things. And why does it do that? Well, this is essentially this stomach, and this is a huge stomach, but this stomach is made to stretch. It's a big muscle. It also is a secretory gland. It secretes hormone, specifically ghrelin, and it also secretes acid and histamine. So what's supposed to happen is this pouch is supposed to hold a bath of acid for about an hour or two while food comes down or fuel comes down this way. It gets liquefied, and when the stomach sensory fibers detect there's no more solid and it's more liquid, then the pyloric sphincter opens up, and then food is allowed to come down this way into the duodenum, and then the ileum, and then the jejunum. That's the small intestine. Duodenum, ileum, jejunum. And in this small intestine, you're supposed to absorb as much nutrient as possible to get all the nutrient into the bloodstream and all the waste material going on down into the colon. Now, I guess I'll complete this anyway. After it gets into the colon, it makes its way to the cecum, and then it goes to the ascending colon, transverse colon, descending colon, and into the sigmoid, where it's stored until you're ready to poop. That's why that's flexible, and that's why it's long. So when you get a colonoscopy, you usually get knocked out, and the scope gets started to hit this way, this way, this way, this way, all the way to here to look for colon cancer. Pretty good test. It's worthwhile. It can get polyps, especially if you have Lynch syndrome, or in the family, if you're familial polyposis, you should get those polyps taken off. But because of our topic being mostly DGL, I'll concentrate on the stomach. So the stomach acid here it should not digest, it should digest food and a little bit of beverage and a little bit of bacteria, because there's a lot of stuff that comes down the pike, and you don't want everything into this delicate area. This is where you have absorption of fuel and food, macronutrients, and some minerals. But this lining of this tube is supposed to be very smart. It's supposed to, with a tight junction, allow good stuff into the bloodstream and keep bad stuff out of the bloodstream. I just did a video on leaky gut, so please look at that, because sometimes what happens is when this small intestine gets beat up, say with too many toxins, way too many bacteria, not enough digestion in the stomach, and the stomach sends food down here, semi-solid, that still hasn't been broken down, this thing will get irritated. Specifically in my video, I talked about gluten and something called lectins. So we have to take care of the small intestine. But again, for this lecture, this question, I wanted to focus more on the stomach. So this bath of acid is supposed to digest food pellets, but it's not supposed to digest itself, and it can do that. This acid can digest anything. I think the pH is like 3 to 4. So you can, if you dump it on your hands or vomit on your hands, that wouldn't be a good thing, because you'll start to digest the outer layer of your skin. I mean, it's not going to be that bad, but it takes some time, and hopefully it smells enough and is gross enough that you'll wash it off and not just leave vomit on your hands. However, if this lining of this stomach doesn't make the mucus that it's supposed to make, it's supposed to be a super thick layer of mucus. I keep on thinking like the alien in Aliens, the movie. That monster had acidic blood, but it was covered in mucus because some director or screenwriter figured, well, if you have acidic blood, you have to have mucus somewhere. So, and that, I think it takes it from this model. If you have enough acid that's made in this bath and sits in this this flask, the flask has to be bulletproof to digesting itself. If it's not bulletproof, say you have blood type O, or say you smoke or drink too much coffee and you've eroded the mucus lining, if you take away the mucus lining, you also take away the protection from its own acid. And that's when you have these things, these holes, these wearing aways of the lining, called ulcers. Ulcers hurt, and they hurt because they're like an open sore, just like a sore on your elbow. If you keep on breaking the sore open, the elbow never heals. Same thing with this. If you keep on eating bad food or irritating foods, irritating alcohols, high acidic or high irritating coffees, tomato, you'll never heal this up, because you essentially break the scab every, 6 hours when you eat. Or if you get stressed out, you get a lot of acid being made, or the mucus layer isn't made and the balance is off. So there's only one medical disease. It's called Zollinger-Ellison Syndrome. It's when you make excessive amounts of acid. Otherwise, you're not supposed to make the acid that much. And if you do make the acid, you're supposed to make mucus. So that's where the imbalance comes in. And this is where something called DGL is very helpful. And we'll talk about that in a second. But things that decrease the acid lining would be food sources. If you can decrease the acidity of the food, you'd be great. If you can't do that, then what you can do is you can take something like this. DGL, can you see that? DGL is an acronym that essentially stands for licorice. Deglycerated licorice works to, if you chew one of these, it's supposed to be an unboxing, but I'll just go ahead and open it. If you chew one of these, I just happened to buy a bunch of them from Fruitful Yield. Smells like really strong licorice, so it comes like that. And you chew it, you mix it in with saliva, and you get, that's really black licorice flavored. But you mix it in with saliva, you get this slimy saliva mixed with licorice stuff, and you swallow it, and it coats like a foam fire extinguisher. It coats the irritations in the stomach. I don't want to talk out my mouth, but I don't really like black licorice. but it's all right. Anyway, if you do this, but yeah, don't chew it. Try to suck on it and get some good amount of saliva going, then swallow it. You do it 5 minutes before you eat, it'll protect the stomach in a bit. And because it just coats the lining, if you're not making your own mucus, it'll be the mucus for you. And hopefully when you start to eat, the acid, the sensory fibers in the mouth and the esophagus will makes acid secretion. And the acid won't irritate the already irritated ulcerations or reflux areas. So that's a very helpful thing. A patient of mine brought in this powder. That was a tablet. This DGL is a tablet. A patient of mine brought in this powder by Barleans. Pretty decent, although it comes in a powder, so you have to mix it up. Those are the ingredients, and I don't know if you can see that. Sorry, the light's off a little bit, but I don't like powder. And then you got to mix it, so it's very inconvenient for me to do that. However, I would say the chewables are nice. If you wanted to get more slippery stuff to coat even not only the stomach but the small intestine and the colon, here's my babies. So, slippery elm and marshmallow root. I just bought this for the video. I'm not going to leave this. I'm not going to open it in case a patient comes in. I'm going to use that, or in case I get sick, knock on wood. Marshmallow root and slippery elm are very, you know what, I'm going to take a smell of this anyway, because I've smelled the powder, really earthy. In other words, it tasted like dirt. Oh, well, I don't know what that smells funny. So marshmallow root. Doesn't really smell like marshmallow, at least the white marshmallows that we know of. I don't think marshmallows naturally come white in nature. I think they come like that. Oh, so this is how it looks, marshmallow root. Brown capsule. Again with, I don't know if I smell the capsule cover or if that's the ingredient called marshmallow. This is slippery elm. Wow, that smells like paint for some reason. So, and that's how that looks. So taking a serving of the marshmallow root or the slippery elm on a regular basis is supposed to get to, it works great for a colon, but it can work as it passes through the stomach too. All this stuff is slippery. So if you've ever eaten okra, okra is super slimy, and it's kind of weird going down. The sensation when you bite into it, soft and weird. Never liked okra, but I think it tastes good, and it also makes me feel good, so it must be helping my stomach. So these are the go-tos, and they're all from the same company. Nature's Way is pretty good company. So those are what I usually will rely on for anybody with leaky gut or reflux. As I mentioned, my patient brought in that powder that you can essentially mix up in water, drink it, and then maybe before you eat. So the beauty of, again, the beauty of a chewable capsule is you can eat it anywhere before you eat, or if you get irritated and you're anxious. The mood can certainly set this off, so you have at least protection any time of the day. Just take it out of your pocket versus mixing it with a bottle. So the typical treatment plans will be Tums, and the only thing Tums, it does taste good, but the only thing this does with calcium carbonate is it changes around the pH a bit. It decreases the acid temporarily, but what happens is you'll have this, after you have enough of this alkaline, you'll have an alkaline wave. Acid will come back even stronger than before, so you have to be careful with your Tums. It used to be good for women because they would get calcium in to fight osteoporosis, but you know that was such a wrong decision because studies have found in parts of the world where you take calcium outside of its normal food sources, you just take it as a supplement. Those parts of the world where you eat the most supplements of calcium have the highest fracture rates of hips and backs. So just doing calcium is not good. Eating foods with calcium, dark leafy greens, legumes, seeds, nuts, that's more important. And that's where you don't have a fracture. The fracture rates are lowest in the world. There's also liquid antacid. This is always, I used to remember Malox when I was growing up. This is the equivalent of Mylanta. So this is aluminum hydroxide, magnesium hydroxide, and simethicone. And it's, I don't think it has any smell to it. I forget what this smells like, but it's out of my house. It's been just, it smells like mint. So that's probably simethicone. So kind of cool, gets a little dusty, but it's nice to have in the house. And this is classic Pepcid or famotidine. Famotidine is an H2 blocker, histamine blocker. As I mentioned, you have histamine cells in the stomach lining, and if you can get the histamine cells to calm down with a histamine blocker, you might decrease a little bit of acid production. That's not as strong as your PPIs, omeprazole, Prilosec, Protonics, Acid. Those are proton pump inhibitors. They shut down everything. They shut it down so well that your body gets used to having it, so that if you stop, even if you destroyed or cured or healed your stomach, if you stop the PPI, your stomach will become irritated because it wants more PPI. So that's why I don't like PPIs. Plus, there have been some reports of pancreatic cancer with chronic PPI use. And the black box warning when I was in residency, or first year out of residency, it used to be 3 months and you would stop all PPIs. But now we have people taking that stuff forever. And usually the excuse is that you're trying to take care of a Barrett's esophagus. And that's a precancer. So if you have a precancer, it's worth it to take a PPI? I don't know. I would say it's worth it to change your diet. Stop coffee, stop alcohol, stop spicy food, stop tomato, maybe work on your gluten and lectins and dairy, and then heal it up. So I just don't see how. The other problem I see with a PPI is that when you block all acid here in the stomach, this is a barrier to the inside blood vessels and the inside of the body, a barrier to stuff from the outside of the world, the environment. And half of the bacteria that you take in when you shake hands, when you get somebody to cough in your face, when you eat poorly prepared food, when somebody went to the bathroom, didn't wash their hands and they touched your food, or you go to a foreign country, whatever it is, the bacteria and the parasites are supposed to die in this acid bath. So if you don't have any acid because you turned it off from a PPI or turned it off with an H2 blocker, you lose the barrier, and nasty bacteria goes on down into the small intestine, starts to wage a war with your own bacteria. So that's another reason why you shouldn't be taking proton pump inhibitors or acid blocker for too long. So what I would also do is try to get you some fiber, and I talked about this in my video on leaky gut. Acacia is a nice fiber. I also like psyllium husk, and they all work as prebiotic. So prebiotics work to give that slime to the bacteria. If the bacteria's in the large intestine mostly and a little bit on the small intestine, if they don't have a slimy layer, then they don't have a house. If they don't have a house, they won't survive. So if you do take a probiotic, you should take a prebiotic. Obviously, I like Now Foods because it's a local company. Let's see. Oh, yes. The other problem is if you happen to have a problem with diabetes will slow down. That's important too, to know. There's supposed to be a little bit of transit time. So transit time in the mouth, just a second so you can talk. Transit time to the esophagus, a couple seconds till you feel the bolus go down to the stomach. That's why you feel tight, and then the food goes down to the stomach, then it dumps into this basket. Transit time in here is supposed to be about 4 to 6 hours, depending on how complex the food is that you eat, depending on what kind of acids you have in the stomach. If you don't have any acid, transit time can be really screwed up. And again, that's another problem with PPIs or H2 blockers. If you have no acid and you're eating very complex foods, they're going straight into the small intestine. Small intestine doesn't like that because it's a portal into the bloodstream to touch your immune system with big proteins, and you don't want that. So if there's no breakdown of food here and you present that here, you can be in big trouble. That's why it's sometimes important to also take digestive enzymes. So this is Nature's Sunshine, pretty decent company, and they have a whole bunch of digestive enzymes over here. So if your pancreas isn't making enough, pancreas sits around right here. As the food starts to leave the stomach, the pancreas senses it, the liver senses it, and they start to dump their digestive enzymes into this area. That's why I put I didn't put the liver. It's supposed to sit over here, and the pancreas sits behind. But it meets the liquidized food right here in the duodenum, and it starts to digest even further. So that's, if you don't make your own, if your pancreas is shot, if you've had a Whipple's procedure, that's a pancreatic cancer procedure where they cut out everything, then you're going to have to take digestive enzymes for life. Some people who just have a very challenging lifestyle where they don't make the pancreas is for some reason not working properly, or they're not making enough acid, you can take your digestive enzymes. You have to take this every time you eat, and it gets to be a pain, but a lot of people get used to it. I have 2 patients that have survived into their 70s and 80s with pancreatic cancer post-Whipple. That is awesome. And they have to do this every time they eat, which is fine, better than dying. So the other problem, if you're a diabetic, so I was getting to transit time. If you have an issue with nerve irritation, like in diabetes or neuropathy, or the vagus nerve isn't working right, you want to speed up the transit time, because sometimes slowing down transit time, keeping more food in your stomach for a longer amount of time makes you feel satiated, makes you feel full. That's one of the ways Victoza, which is a diabetic drug, works. It slows down transit time, makes you full so you can lose weight. That's the theory. But unfortunately, it also stays there for a long amount of time. So if you go lie down, you also barf up a lot of food. So you have to be careful. However, I will tell you, if you have a slow transit time, ginger is awesome. So this is Newmark. This is a doctor's version of, I forget which company this is, but ginger tonic can, if you take it on a regular basis, will help you move along the digestive tract. So it helps with movement. If you get constipated, if you're full all the time, if you feel like you're going to throw up, get nauseated, the ginger is great. Ginger has been used as far as nausea for chemotherapy, also with digestion, and sometimes some pregnant women will use this too, ginger ale. So it helps with calming the stomach down and getting it to move. Great stuff. So you can see that there's ways to take care of things Western or conventional medicine style. If you have to, then do it. If you have to use Pepcid, do it twice a day, 40 milligrams. I'd rather have you do that, which is prescription, instead of the PPIs. I know the PPIs are super strong, but they're super strong and they can be very addicting. So that's the last thing I want you to do. I have a how to wean off a PPI. I remember getting a comment just recently that some lady said that she didn't want to wean off, and don't listen to this doctor because people that suffer from acid reflux get relief, and that's true. But the majority of people I see with acid reflux don't follow the rules as far as food. So if you're taking a big old medicine, but then you're taking a big old pizza, or you're having some alcohol and coffee, what are you doing? You're kind of defeating the purpose. So I would be very careful with using food, even to the point of stopping gluten and dairy for a while, has your relief or has your savior. You can reverse this because most of the diseases that we get, whether it's leaky gut or reflux, esophagitis, colitis down here, all those itises are usually they're man-made because of either stress, bad diet, full eating a big meal and then going to sit down instead of walking like they do in Italy. So I think there's things that you can do to improve your chances of avoiding this crap. So you just have to understand the pathophysiology. So hopefully this gives you, Ignacio, hopefully this gives you a little of an idea of what to do to beat some of these symptoms. If you have an ulcer and you still need this, or you have to go onto a PPI and you have to use a PPI for more than 3 months, it's time to go to the GI guy so he can put a scope down here and actually get a biopsy. At that point in time, they have to get a biopsy of the esophagus, where the lower esophageal stomach junction is, to look for Barrett's esophagus, precancer, and then get a biopsy of the stomach to look for H. pylori, bacteria, and just see the folds. So that's best when you visualize it. So usually when the GI guys have to see you, that means because you've been requiring too much medicine, they'll scope this way and they'll scope this way. So you get a double scope. And it is helpful. It cleans you out, but not a fun thing to have. However, it makes the doctor and makes the patient a little bit more satisfied that there isn't a big disease going on. So again, it usually can be controlled if you control your diet and your beverages, take care of your stress, eat and walk, exercise, don't eat too much. And then also, if you do have a temporary respite, then use the herbs to feel better as best as you can. Use a diet to manipulate. I've seen some great results with certain probiotics, but that'll be another lecture. So Ignacio, hopefully this gives you a little bit of an improvement on understanding. Now, for those of you who have your own way of dealing with some of these symptoms of reflux or ulcers, please put them in the comments down below. The one thing that's different between ulcers and reflux, and I'll put a link to the GERD video I did a long time ago, is ulcers, reflux is just a mild irritation. Usually it's up here in the esophageal stomach junction. Ulcers burn a hole. They eat a hole through the whole wall. And the problem with this one here, or the ones that are right in the backside, there's a big aorta back here. And if you burn a hole through the stomach wall, you can actually melt through the aorta and cause a really bad bleed. So when you have a large liver over here, there's blood vessels here called varices. They can bleed with a lot of vomiting. If you have an ulcer in the wrong spot, that can bleed. If you just have an ulcer on the inside, it can bleed into the stomach, and you'll digest the blood and you'll vomit up what looks like coffee grounds when you don't remember eating coffee. So that's digested blood. Sometimes you'll actually have, if it's moving fast enough, black poop coming out of your butt because of the digested blood up here, or the vomiting of a coffee ground. So that's not a good sign. That's when you have to be in the hospital, shut down the acid 100%, coagulate any bleeders, and sometimes it might take you more than that with interventional radiology to stop bleeding. But so that's it in a nutshell. Hopefully this gives you a little idea. Thanks for watching up until this point. Don't forget to subscribe to me and watch when I do new videos.